Okay, Nicole, we're ready to. Thank you so much. Okay, welcome everyone. We are so happy that you're here. Welcome to TAPI's training titled 10 Things School Nurses and Health Office Staff Need to Know About Why We Immunize. So we are looking forward to this training today. We have many people registered to attend today from all over the state, not only Pima and Maricopa County, but we had several people register from Mojave, Pinal, and Cochise counties. In fact, 10 counties in Arizona are represented today. So we are so glad to have a variety of counties with us. We have a lot of school nurses, district leads, health assistants, and more joining us today. So welcome everyone. Just a few reminders. Please keep your microphone or phone on mute unless you are speaking. Feel free to use the chat box to ask questions or answer our trivia questions later on in the training. And all of the handouts and videos from today will be available after the training, including a recording. Now, if you are wanting to obtain CEUs for the training today, you must attend 90% of this training to get those CEUs. Watching the recording later will not count for that. That's just the rules the CEU board gives us. Just a disclosure that presenters have no financial interest or relationship with the commercial supporters of this activity or manufacturers of the activity. So you may or may not know what TAPI is. So TAPI is the Arizona Partnership for Immunization. We are the statewide vaccine coalition. Our mission at TAPI is to foster community wellness, advocate for good public policies, and best immunization practices. I see a question in the chat already. Will the CEUs automatically be sent out for those in attendance? No, you do have to fill a separate survey later on. That survey link will be emailed to you today. Okay, so why do we immunize? The objectives of this training are to discuss 10 science-centered, evidence-based concepts about why parents should vaccinate their children. We're going to answer some common questions and address misconceptions, and teach you how to distinguish myths from facts, and also provide you some credible online vaccine resources so you know where you can go for information to send to parents or for yourself. You can know what information would be best. And the overall goal today is that the attendees become knowledgeable on vaccine benefits and will help parents make more informed decision on their intent to vaccinate their children. We will have some quizzes throughout the presentation, so make sure to put your answers in the chat box. Just an introduction, my name is Laura Smith. I am the Program Manager of Community Education here at TAPI. I've been with TAPI just over 4 years, and I love what I do. I have a bachelor's of public health, and I'm also a certified health education specialist. Later on in the presentation, we will have Dr. Gail Hawk do a presentation on cervical cancer and HPV vaccine. She did this presentation for us at one of our first trainings, and you all loved it so much that we keep asking her to come back. So we're so happy she's here with us today. She also leads the Arizona chapter of the National Cervical Cancer Coalition, and is a professor or was a professor. She is always doing so many different things. So I'll let her tell more about her when we get to her presentation. I want to show this quick video about some things we have learned from vaccination.
I want to tell you about a time in American history so that it never repeats itself.
So it never repeats itself.
It was a harrowing time.
A heart-wrenching time. I could hear my mother warn me, "Seal, don't go out and play."
My family was ravaged.
Thousands and thousands died. I was scared.
So scared.
And then one day...
And then one day, there was hope.
Before vaccines, there were few ways to help protect against deadly illnesses. Diseases like measles,
Meningitis,
diphtheria,
Hib,
Whooping cough.
or polio, which killed my grandma's youngest son. Without vaccines, these threats can reemerge.
I'm here.
I'm here.
I'm here to tell my children to help protect their children.
Get your kids vaccinated and keep them on schedule.
I never want my grandchildren to see what I saw.
The real dilemma that we have to face now is that because of the effectiveness of vaccines over the past 50 to 75 years, people have forgotten about the diseases those vaccines were developed to fight. This is a phenomenon called vaccine amnesia or public health amnesia. Maybe you've heard of that before. It's where a public health initiative such as vaccination becomes so successful that people forget how how bad it once was. And then we can see things like measles cases start to pop up more and more around the country. I'm sure you all have heard of the measles case that is here in Maricopa County right now. I know that the state health department, county health departments are tracking that closely and hoping that we can prevent an outbreak. Is there anyone that has been on high alert from that possible measles case? I know as school health officials, you will be the point of contact for those parents. So we are already getting questions from school nurses saying, what do we tell people? How is that, what are we going to do? And the answer for that is we are watching it very closely in conjunction with the state health department and local health departments. But please reach out to TAPI if you have any questions, if you need help with anything, we are happy to help. So we're going to go through the 10 things that school health office staff and school nurses need to know about why we immunize. And then we will have a presentation, and then we'll talk about the immunization data report. So let's start off with these 10 things. The first one is kids are at risk for disease. So this map shows exactly what we're talking about with this public health amnesia. Measles was thought to be eradicated in the year 2000, but in 2014, new cases started popping up in unvaccinated communities. On this map, and 5 years later, we see that in 2019, all of the states in dark blue reported at least one case of measles. So if you count them up, there are over 28 states that experienced at least one measles case. That's more than half from a disease that we believed had been eradicated. So the problem persists. These outbreaks are a direct effect of lower rates of immunization, and this shows that even when you have not seen a case of a disease in 14 years, that does not mean it has actually gone away. Continued immunization is the only way to prevent these diseases long term. And then we also know that pertussis or whooping cough is also beginning to recirculate. Oh yes, Gail in the chat, it was a school nurse that figured out the measles cases in Arizona were from the Disneyland outbreak. School nurses are amazing. I'm very, very excited that you're all here today. Okay, let's see. Next one. Arizona kids are especially at risk. So ADHS, the state health department, requires every school to report once a year on the coverage level of kids enrolled in schools. This information is made available to the public, and parents can be informed about coverage levels. There actually is a website where you can check specific schools and what the immunization rates are in their kindergarten and 6th grade students. Our schools used to be at the 95% coverage rate, but in the last 5 to 6 years, the level of protection has begun to drop as the number of vaccine exemptions have begun to increase. Some schools have only 40% coverage. Arizona has been identified as a hotspot because of low coverage levels. Number 2, vaccine preventable diseases still exist. The data shows that the diseases still exist and are circulating. However, I could argue that if you've never experienced some of these diseases, you could fall into the trap of believing that they no longer exist or they probably will never touch you personally. I have a short video here, and it can be really hard to watch, this one of the baby. I'm going to let it play the full 2 minutes because I think it's really important that you understand the impact that these diseases have.
They're just kind of heavy. Uh-oh. There we go. Okay. It's okay. Okay, take a breath there, honey. Come on. Almost there. There we go. Oh my. It's okay. It's okay. Yeah. It's okay. There. Okay, sweetie. Right. It's okay. Yeah. It's okay. Yeah. I know. Yes, it's me. Oh, I know. It's okay.
Okay, the video is always hard to watch. I've done this training dozens of times now, and I just feel so sad for that baby that is trying to breathe. She has pertussis or whooping cough, and she is too young to be immunized. So she really depends on the community around her to stay up to date on that pertussis vaccine. And then the man on the right, he has mumps. So you can see his face is very swollen, and that is what it looks like. Number 3, outbreaks are preventable when parents make the decision to vaccinate. When we immunize 95% of a population against a vaccine preventable disease, we can prevent an outbreak from happening. So I know we already talked about measles, and that's kind of on everyone's mind right now. Measles does need about a 90 to 95% immunity for that vaccination rate. And right now in Maricopa County, we're hovering right at about 80%. And I know some of the other counties are even lower. So the way we have traditionally prevented those outbreaks was to keep 95% of the population immunized, because if 95% of the people have immunity, it's really hard for those diseases to spread throughout the community. It is very important that our youngest kids are immunized before entering school so they can protect the community around them. I have several kids in schools right now, and there is no sense of personal space or bubble that they have. They are always swapping illnesses and coming home with a cough. And, it is very quick how germs can spread through a school. And then those kids can take it home to immune compromised family members, which is how these diseases can spread. We are attempting to keep our communities healthy, and I think the best way to do that is to vaccinate. It's easy to think about community immunity or herd immunity in terms of a fence, kind of like the planks of a fence. So the planks are the people who are immunized, and they protect those around, those inside that are immune compromised or too young to get vaccinated or maybe have an allergy to a vaccine. When a disease comes up, it will hit the fence, and those immunized people will not get sick, and the disease cannot spread through to the immune compromised person. So outbreaks happen when there are too many holes in the fence and a disease just floats right through. Once it infects an unimmunized person, it puts all other unimmunized people at higher risk. Sorry, that's a big tongue twister. But if you have any questions, please put them in the chat. We're happy to answer them. Number 4, we know that vaccines work. They are studied and then they are followed to see how well they are working. We want to make sure that you have the hard evidence that vaccines work. Once we have a vaccine against a disease, we have been able to eradicate, eliminate, or decrease the number of cases to almost 0 after a vaccine has been introduced. So you can see on this chart, it's a little bit small. If you're on your phone, it's super small, but you can see here that the diseases here are on the left in the green. And then after vaccines are introduced, you can see how much it has decreased. Smallpox is decreased 100%. It was eradicated in 1980. We can see measles here. It was eliminated in 2000. After that vaccine happened, decreased 99.9%. But like I said, we do have to keep immunizing people to keep those rates of disease so low. Once a vaccine is approved for use, it is still constantly tested and researched for safety and efficiency. These diseases go away because vaccines work. According to the CDC, vaccines save an estimated 42,000 lives every year in the US alone, which is 3 times more than seatbelts and child restraints combined. So think about that for just a minute. Choosing not to vaccinate a child is like putting them in a car with no seatbelt or child restraint. Most of the time, it probably would be fine, because how often do you actually get into a car accident? Maybe you're only driving around the neighborhood or 1 or 2 miles, but it really just takes a single incident for a seatbelt or child restraint to be worthwhile in saving a child's life. And likewise, it only takes a single exposure to a disease that you can't even see for the child to become ill with one of those other diseases, and the long-term effects on their health can be very serious. That is, if they survive. Number 5, vaccine offer protection to us, sometimes in different ways. So we know that vaccines protect us from getting the actual disease, but newborns who are too young to get vaccinated are protected by their mother's vaccines. This is the first protection, but it does begin to wear off around 2 months of age. This is why there's a vaccine schedule that starts when the baby is 2 months old to continue that protection. There are some people who cannot get vaccines. They're too sick or they have allergies, and these people are protected by those around them getting vaccinated, just like the fence analogy we talked about. Just as a side note, I think you should know that only approximately 1 in 1 million children have a true allergic reaction to a vaccine. Sometimes people get swelling or a rash or start to feel sick and think that's an allergic reaction, but that's actually your body's immune system developing that immunity. The CDC has researched the best time to give vaccines to offer the maximum benefit. So that's why we recommend to follow the CDC schedule for that. Number 6, vaccine antibodies act as personal ninjas to protect from the actual disease. So after someone does get the disease, it can take several months to years for their immune system to fully recover, leaving them vulnerable to other illnesses and diseases. So it is really better to get the vaccine. The vaccine tells your body that it needs to equip itself against this disease before you are ever exposed to it. And your body in response creates a bunch of antibodies that are like little ninjas just waiting to fight off an exposure. Many years ago, when the vaccines were developed, they had a lot more antigens in them to protect against the disease. You can see these 30 years ago vaccines. These are the vaccines I got 30 years ago, and these ones are the ones my kids are getting. Now the vaccines have been refined and updated to reduce the amount of antigens needed to protect against that disease. All of the research on safety and efficiency makes it possible for vaccine developers to make sure that they are improving vaccines and making them easier. Okay, time for a trivia question, time to use your chat box. What vaccine is recommended during pregnancy? A is pertussis or Tdap. B is flu. C is COVID. D, RSV vaccine. Or E, all of the above. So type your answer in the chat box. We'll give you about a minute. Okay, most people know the correct answer is E, all of the above. Thank you. Blanca is helping me in the chat box today, so she will let you know if you are a winner. She'll send you a private message. So yes, that's correct. All of the above, the pertussis, flu, COVID, and RSV vaccine are all recommended during pregnancy. Babies get their first vaccine from mom. There are new recommendations focused on pregnant mothers that during every pregnancy, the mother gets a flu, pertussis, and COVID vaccine, and now RSV vaccine to protect her and her baby. It's really important to talk to the OBGYN about when and where to get these important vaccines. Many people have all members of the household get these vaccines to increase the protection for the newborn, because the vaccines in pregnancy are the baby's only line of defense until they can start getting vaccinated at 2 months. So, excuse me. So, I was pregnant during the beginning of COVID and had a beautiful little girl. She's now 3, but she was born with some health issues. And we found out about that during pregnancy. And so I made sure my other kids were all up to date on their flu shots. And my husband and I got our Tdap vaccines and flu vaccines. This was before COVID vaccines were available for pregnant people. But it was really important that as people living in the house with this brand new baby, that we were able to protect her as much as possible. Gail, do you have a comment?
I just wanted to say my daughter-in-law had a suspected case of COVID in January 2020 before we were testing. She had a placental abruption, most likely related to COVID, had a baby at 25 weeks who's fine now on 4. but she is pregnant again, most certainly got vaccinated. It's a real risk and it can cause some real problems with clotting and so blood clots and so forth. And fortunately, she had a good outcome, but not many. I mean, when they're looking retrospectively at pregnancy and COVID, they know it was most likely responsible for a lot of premature births.
Thank you for sharing. I see a question in the chat. Would a Tdap be needed if mom is up to date? So they do recommend for every pregnancy that you get a Tdap. So that's what I have done every time. Even if your kids are close together, they do recommend because that is protecting the baby as well. Hope that answers your question. Fight the flu. Your best defense against the flu is a flu shot. So here's a great reminder. If you have not had your flu shot this past flu season, you can still get it. We're kind of ending flu season soon, hopefully. But there is a lot of flu going around in our schools, especially. Let's see. So if you do feel sick, just a friendly reminder to stay home. You can put on a mask, cover your cough, wash your hands, all of that. So make sure that you stay healthy as well, especially when working with all those kids in the schools. Here's another trivia question. So put your answer in the chat. Can someone get a flu vaccine and a COVID vaccine in the same visit? Okay, we still have a few people typing in their answers. All right, let's see. Yes, yes, yes. Not sure. Thank you, Jessica. Or Carla. It's okay if you're not sure. That's why you're here and we can help you out. The answer is a yes. You can get a flu vaccine and COVID vaccine in the same visit. And that's what I did this flu season. I got them at the same time. And sometimes you can get them in the same arm or different arms, just depending on who's giving that vaccine. Both are fine to do. And it saved me another trip to the pharmacy to just get it done at once. So, okay, number 8. Let me stop sharing for just a second. It looks like there's a weird little line on my screen. Bear with me just a second. Okay, hopefully that went away. Okay, number 8, doctors and science support vaccination. These organizations all support vaccines as a strategy to keep kids healthy, and trust your healthcare provider. Their education, knowledge, and experience is what we can rely on if you have questions. They are also a really great place to send parents if you get stuck on a question that they have about vaccines. So the American Academy of Pediatrics, Academy of Family Physicians, obstetrics and gynecologists, American Nurses Association, the CDC, March of Dimes. NASN is the National Association of School Nurses, and School Nurses of Arizona, all strongly protecting children with recommended vaccines. So love to see all of those school nurse associations. They're great. Number 9, off to school and up to date on shots. So vaccines are required when children enter childcare, preschool, or kindergarten to protect them and their classmates. Like I said earlier, it's really important those kids are up to date on vaccines before they enter the classroom. You don't want your child sick or bringing home a preventable disease that may expose a younger sibling or an older adult that's under immunized. Each state has their own requirements in terms of school entry and vaccines, so make sure that you get familiar with your school requirements. The CDC website also has information for all 50 states if you're unsure about the specific requirements that you have. Number 10, kids still need protection as they grow. We talk a lot about baby shots, but the same recommendations for vaccines continue throughout their life. We recommend following the CDC schedule for immunizations, and they do update that every year. There is a new schedule for 2024. Basically, it has updated the RSV vaccine for babies and pregnant people and older adults, and also added the Mpox vaccine to the schedule if needed. So you can go to the CDC website to review the recommendations, and TAPI is developing an updated flyer as well, which will be available. We're going to watch this great video about that talks about why vaccines work. It's a great foundation for understanding vaccines. It's a little bit sciencey, but I think you guys will really like it. And then we can answer any questions that you have after the video. Please put your questions in the chat if you have any.
Aren't you glad you don't have scurvy? In 1747, in the first medical trial ever performed, Scottish physician James Lind found out that eating citrus fruits could cure scurvy. Now, today we know this works because citrus contains high levels of vitamin C. In fact, ascorbic acid, a common name for vitamin C, comes from the Latin for not scurvy. By issuing rations of lemon juice to sailors, the British Navy was able to pretty much eliminate the disease until the late 1800s, when polar explorers suddenly began to see scurvy again. The copper pots holding their lime juice had destroyed the vitamin C, but they were pretty confused. So despite James Lind's experiments 150 years before, citrus fruits became the enemy. And when Robert Falcon Scott set out to reach the South Pole in 1911, he carried the finest in canned meat products, biscuits, chocolate, tea, and zero vitamin C. A Norwegian team beat them to the pole by 5 weeks, and during their sad journey home, Scott and his team perished in a blizzard, sick and weak from what was probably scurvy. It had been so long since anyone had seen this disease, the British had forgotten how to prevent it. When we create such effective solutions, we can forget how serious the problems were. Thankfully, people today don't die of scurvy or polio. Since the introduction of Jonas Salk's polio vaccine in 1955, the disease has been nearly eradicated from the earth.
The thing to remember is that this is a continuous process.
Compare the 358 infections reported in 2014 to the 1940s, when 500,000 people per year were paralyzed or died from polio infections. Vaccines work. Our immune system is on constant alert against germy baddies, with millions of white blood cells each on the lookout for specific infections. When an immune cell meets its target, it replicates itself, and this clone army sends a barrage of protein weapons called antibodies to label the trash for cleanup. And after the infection is gone, so-called memory cells stick around, ready to mount a fast attack in case this germ shows up again. This is how we develop immunity, and it works pretty well, since we're all still alive. But even with all that, some super bad germs can take us out before our immune sentries have had time to call up their clone army. This is especially true for young children. Their immune systems are fresh out of basic training. Thankfully, we have vaccines, which are made of tiny pieces or weakened versions of viruses or bacteria. They let our immune system see what the bad guys look like and recruit those all-important memory cells before we ever have to actually see the real enemy. Thanks to vaccines, the US was able to eliminate measles in the year 2000. But in recent years, as more and more parents are refusing to vaccinate their children or are vaccinating them later than what doctors recommend, it's back. In most states, more than 90% of children are vaccinated, but that's not enough to keep a disease like measles at bay. In our episode about Ebola, we talked about a number called R0, the basic reproduction number for a disease, or the number of people infected by one person in a susceptible population. For Ebola, that number is low, but for measles, each sick person will infect up to 18 others. But luckily, vaccines can change that. The fraction of people who are vaccinated or immune can lower the reproduction number below 1, which means the disease is disappearing. 90% of unprotected people who come in contact with somebody who has measles, even just breathing the same air, will become infected. To control a super contagious virus like that, the vaccination rate has to be 95% or above. And right now the US is lagging behind, and measles is making a comeback. The Guardian put together a simulation of just how this so-called herd immunity works. When enough of a population is vaccinated, even if it's not 100%, the herd can protect the unprotected. With vaccine refusal on the rise, our herd immunity is breaking down. Preventable diseases like measles and whooping cough have become our scurvy. Most of us don't know anyone with polio, and I mean, measles. It's not that bad, right? Well, yes, it is that bad. Before the age of vaccines, millions of people were killed by diseases that today are just bad memories. Vaccines have let us develop a sort of generational amnesia. Today we expect our children to grow up healthy, and we're lucky that we don't appreciate just how dangerous these diseases are. Like science writer Seth Mnookin says, vaccines are victims of their own success. Because of stories like Andrew Wakefield's discredited study wrongly linking vaccines and autism, and the news media's obsession with pictures of crying, terrified children being poked with needles, people are nervous about vaccines. This anxiety isn't new, though. When Edward Jenner in 1798 saw that milkmaids didn't catch smallpox, well, he realized that because they'd been exposed to the similar cowpox disease, they were immune. And based on this, he developed an early smallpox vaccine by inoculating humans with the cow virus. In fact, the word vaccine itself has bovine origins. Still, as far back as 1802, critics were claiming that the smallpox inoculation would turn you into a cow. Vaccines don't come without risk. Nothing does. But on average, fewer than 1 in a million people will experience a dangerous reaction to common vaccines. And car accidents, playing outside, even walking will injure more children. Vaccines are asking us to do something altruistic, to make a choice to protect not only ourselves and our children, but also those around us. Author Eula Biss says that vaccines are one of the most empathetic things that we can do. A system that's based on people voluntarily using their bodies to protect other vulnerable people. And that's something I hope we don't forget. Now, I'm a doctor, but I'm not that kind of doctor. It's natural to have questions about vaccines, and you should have a conversation with your medical professional. They want the best for you and yours. I will give you one prescription though, and that's to subscribe so you can get a full dose of science every week. And if you want to read some amazing books about vaccines, check out Seth Mnookin's The Panic Virus and On Immunity by Eula Biss. Links in the description. Stay curious.
Okay, so hopefully that was a good refresher about how vaccines work. And I think it's always good to kind of reset and get all of that information again.
Today we
Okay, we have our presentation by Gail. Gail, is right now good, or should we wait a few minutes? I know you have a schedule conflict. We good to go right now?
This would be great.
Okay, let me skip ahead a few and then we'll come back. So like I said, Gail, if you want to kind of tell a little bit about your background, I think that would be super helpful. And then let me know when you want me to advance the next slide.
So I was first a hospital nurse, and then I wanted a schedule that was better for my kids. So I decided school nursing was for me. And in 1991, I became a school nurse, got certified, still am certified as a school nurse. I spent about 10 years in school nursing, both in the Creighton district for an elementary and then in a charter school for at-risk youth. So probably about a decade. But my school nursing practice led me to graduate school because I felt like I needed to learn more because I was there in my school nurse practice with a low-end Littman stethoscope and a Snoopy eye chart. I don't know if the rest of you can feel that way about your practice sometimes. My orientation was someone handed me a set of keys, and that was pretty much it in 1991. I see Lois is smiling a little bit. Anyway, I was a professor at ASU and I directed a outreach. I was an assistant professor at ASU, but I directed an outreach clinic at called Breaking the Cycle. And we went to a school, a church, and a homeless shelter. We partnered with Creighton District. That was my district. I was the community health nurse on that project, and then ended up directing. And then when we became stationary, I directed that clinic at Grace Lutheran Church. Retired from ASU in 2013, was with TAPI for I think 3 years, and then went back to teaching in California, and then retired from that position in 2021. So I really take my hat off to all the school nurses and school health personnel. You are frontline providers and totally appreciate it. So anyway, but vaccines have been my specialty area since 1991 because I thought everybody got vaccinated. And then surprise, surprise, when I started reviewing those records at my kids' school, I learned something different. So anyway, let's move on to the next slide. I'm here with the National Cervical Cancer Coalition. I want to talk about HPV vaccine referral in school health offices and how you and the health offices can reduce the risk of cancer in the kids that you serve in their future. Next slide. I'm going to go over some of the objectives from the last time, but I wanted to add some new information because I do see some familiar faces here, and I want to add on to your knowledge base. So I'll talk about the burden of disease related to HPV infection, look at the impact of HPV vaccine on cervical cancer in 3 countries, and then how we can apply HPV vaccination standards of care in school health practice. Next slide. So human papillomavirus is a small DNA virus. It's very, very communicable or catchy. There are more than 200 types identified, 40 infect mucous membranes, and transmission is from close, intimate contact. Close, intimate contact. I don't even say sexual anymore. That's not clear on how things, whether intercourse or penetration needs to be a part of that act. We're not 100% sure. So when you think about intimate contact, it involves a lot of transmissional fluids in a lot of places. So most infections are asymptomatic and transient. That means they come and go. Okay, next slide. Asymptomatic meaning no symptoms. So it's so common that, and this is a quote, so it does say sexually active. Nearly all sexually active men and women get the virus at some point in their lives. We call it the common cold of viruses that are transmitted intimately. So the prevalence, meaning all the cases at one time, the new and existing in the United States, are about 42, almost 43 million. And this is from 2020. So data always lags a little bit. And then incidence means new cases annually. And so that's 13 million new cases annually in the US. So you can see that that's a huge burden of disease. And when you think about vaccine preventable diseases, if this was any other vaccine preventable disease, we'd see it all over the news, wouldn't we? Next slide, please. So years ago, when I was working at TAPI, I went to a conference, and Melinda Wharton from the CDC said, when she was talking about HPV vaccine, she said, preventing cancer is always better than treating it. If any of you have gone on that cancer journey with anyone, whether it be HPV related or otherwise, can you imagine if we had a vaccine for breast cancer? And I think someone's working on that right now, but it's not my area, that particular vaccine. So I don't have any data to share with you. But can you imagine if we had a vaccine against breast cancer? We have a vaccine against cancers that are related to human papillomavirus or caused by. We need to work to get it in the arms of kids. So next slide, please. Currently, we give a 9-valent vaccine in the US. It's the only one that we give, and it provides protection against genital warts and cervical cancer, but also other cancers. This is an older slide as well, and I'm going to go over the cancers that HPV vaccine is known to prevent. or help in prevention. Next slide. Oh, I guess I didn't put that slide in there. So this time, Laura, I took it out. So HPV vaccine protects against anal, oral, the genital cancers, cervical cancer. Laura, did I miss any? Do you think?
Um,
Anal, penile, just think all the genital cancers that are related to HPV, and oral.
mhm.
So we have to think about, the mucous membranes, right? Okay. So forgive me, you guys, I thought I had that slide in there. So I do want to talk about the HPV vaccination program success in Scotland. I pulled this from an article that's recently published, and their vaccination program, which is widely across Scotland, was introduced in 2008. They have consistent coverage now at 80%. 80% coverage of adolescent vaccines, Tdap, and meningitis, and HPV. Those are the adolescent vaccines. That's what the Healthy People 2030, that's what the goal is. The objective is to get coverage up to 80% to support elimination of these diseases. And so in Scotland, this article refers to an N, or a pool, of 450,000 females born between 1988 and 1996. Remember, Scotland's a pretty small country. There were no cases of cervical cancer in females that received the vaccine by 12 or 13 years of age. I'm going to repeat that. There were no cases of cervical cancer in this large study in females that received the vaccine at 12 or 13 years of age. They also had a catch-up plan and all sorts of things in Scotland. They also have, and the NHS has cancer registries for cervical cancer. I was traveling in England, and I think it was 2006. And a friend of mine's a nurse there, and I was talking about the work that I do, and she said, "Well, what about your cervical cancer registry?" And I said, "Oh, we really don't have a national registry for that. I mean, we do have registries and EpiData, but we don't have as comprehensive of data to predict, how we're doing with the reduction of not only invasive cervical cancer," and they're talking about invasive cervical cancer in Scotland. So when we measure those cancers, we don't look at what we call stage 0 cervical cancer. We don't capture those numbers. You may hear stage 0 cervical cancer, or you may hear stage CIN3, cervical intraneoplasm at level 3, CIN3. Those numbers we don't capture when you look at cervical cancer data for the United States. And it's because those numbers are so voluminous. And again, we don't have a system that captures those, what they may call early cancers, precancers. Does that make sense, you guys? Okay. All right. So this is like excellent success and wonderful data to have. Next slide, please. Then we're also going to look at the program success in Australia. I really wanted to talk about this because this was, I learned mostly about this school-based program when I was working at TAPI, and the drivers behind it, because there's always drivers behind how things get done. So the national program was introduced in 2007 for girls, and in 2013 for adolescent males. Now, this is a school-based program in Australia, and it got started because the Prime Minister's wife had cervical cancer. She was quiet about it for a long time. And the Prime Minister, it was John Howard, and he intervened to get the cervical cancer vaccine subsidized by the federal government, the Prime Minister in Australia. And he was hopeful that it would be available for a mass vaccination campaign starting in 2008. So then the health minister, Tony Abbott, got behind it. So you can see that there was policy influence at the highest level in Australia, and that's how this got done. And then Janet Howard, his wife, the Prime Minister's wife, had been quiet for a decade because as we know, that there was a lot of embarrassment around cervical cancer, and people are still somewhat hesitant to discuss it because it's related to intimate transmission. So she hadn't disclosed the type of cancer that she had until 2007, I think it was, yeah, around the time that the school vaccine. But once she found out that there was a vaccine to prevent cervical cancer, she got on the bandwagon. So it was she and her husband, the prime minister. Anyway, okay, so they got the school-based program. I see some questions popping up, and I'll be happy to answer if there's time. If Laura gives me, if Laura says I have the time. So this, so I also pulled an article, and it's in my reference list, and it's from 2 years ago. And they looked at, they did a key stakeholder survey. This key stakeholders, I was just like, when I read this, I'm like, oh my God, the key stakeholders report that vaccine hesitancy with HPV vaccine in Australia is not an issue. Not an issue. So the 2020 numbers in Australia, the boys are at 77% complete, and girls are at 80.5. Now, Australia has just made a decision to follow the WHO guidelines. Now they say one vaccine, if you get it in early, is enough. So that's what WHO says, World Health Organization. And HPV vaccine in Australia now for the younger kids and I don't have it in front of me, but the younger kids getting it in by 12, 13, they'll be considered complete, which is excellent news and would make life a whole lot easier for everybody. So next slide, please. So they are on track for elimination of invasive cervical cancer, Australia. Now, elimination means when the risk of a vaccine preventable disease is nearly at zero for a specific geographic region. Like eradication means completely no more risk, like smallpox. So we talk about elimination of invasive cervical cancer. So you can see this is really small. When we look at rates, we look at this, the top one, turn my head. The top one says cervical cancer incidence, and then this is invasive cervical cancer rate per 100,000 women. You can see how it's really dropped. And the goal is to get it down to, where's it? To like, it looks like between 3 and 4 for per 100,000 women. That's what the goal is by 2035 to get that vaccine in the arm of every kid. But remember, there will be people importing HPV into Australia because people go there for, they come and go. We come and go all over the globe, just like measles gets imported. HPV could get imported into this population as well. And then mortality, they hope to see that go down too. And they already have a low there was a low mortality, and that's related to not just to vaccination, but also to early screening and treatment at the early stages of cervical cancer. We don't have any screening for oral pharyngeal cancers, for the oral cancers, and those primarily impact males. Okay, next slide, please.
That is your last slide.
You didn't get that? There's more. There should be more.
Okay.
I've got them up if you want me to
Okay.
share.
Yeah, if you want to go ahead and share it.
All right.
While you're doing that, I did look it up. So what HPV protects, what types of cancers? So the genital cancers, like you said, also cancers of the mouth, throat, head, and neck.
Right. Okay. So those are the oral pharyngeals.
Yeah.
Mouth, throat, head, and neck.
Yeah.
Okay. Hang on. Now, where's the, now I've lost the share my screen thing.
Down at the bottom, the green button.
No, I mean, it's covered up in my slides. Hang on.
Oh, okay.
Hang on. I'll get there. Let's see. There it is. Share screen. Share that one. Oh, thank goodness I taught online for a long time, huh? Okay. I'm gonna go through these real quickly. Okay, so can y'all see my Arizona map now?
Yes.
Okay, so this is what the information that I presented when I was here in October. We looked at Q1 from 2023. And I was here in October of 2023, and so I think some of you were here with us. And this is, when we present ACEs data, we do have to get permission from the health department. So I wanted to go back to what we got permission for to share with you guys. And in Arizona, our coverage was 47% for females, completion, and 43% for males. So I'm not real happy about that. Laura, how do you feel about it? It's probably the lowest coverage we have in the adolescent vaccines. It is the lowest coverage when we compare it to Tdap and Meninge. So one of the things we worked on when I was at TAPI back, I was there 2013, 14, 15, and we, ADHS and the partners at TAPI and advocated that we co-brand the referral form that used to only have ADHS's brand on it with the Arizona Department of Education. And we were able to add, and this is the most recent one, this is from July 2013, we were able to add the recommended vaccines on the schedule, okay? And this is for kindergarten through 12th grade. You know, the preschool one is different. And so what I'm asking you to do, and in October when I pulled the numbers, there were 82,000, a little more than 82,000 fifth graders in the state. So when you're looking at when you're making those fifth grade referrals, when you're referring, all it takes is a highlight of HPV and these other recommended vaccines. It just takes one more second if you got that vaccine record in front of you and you look to see they haven't had the doses of vaccine completed. If they start before they're age 15, they only need 2. And if they, it has to be 6 months apart for the first one, second one. And if they are started when they were older, well, they wouldn't be older than 15 here. So you want to refer them. If they start younger than 15, then they only need the 2 according to the US schedule, okay? So I'm asking you to just, give it a swipe. It's very, very important to me that that happens. And so I'm going to go back to I looked up my number of fifth graders, and you can get this information off ADHS. I put the data link in here, the public data sets, and I was in a very small district, 10 schools. One of those schools is virtual now. I don't know if we have any Creighton school health personnel here or school nurses, but there were 568 students listed in the data, 568 kids that I personally could refer if they needed that vaccine, or I could check to see if they were complete. And it's just so important. We have a vaccine that can prevent cancer. Another one does too, which the hepatitis vaccine, beads. It's also a cancer prevention vaccine. But I just really feel that morally and ethically that I would like all of you just to take the time to make that swipe with your highlighter when you make those referrals. Take that extra minute and make sure that your kids are protected against cancer in their future. I never wanted any kid to come to me if I was working hospital in the summertime and say, I was Mrs. Mel at the time, Mrs. Mel, why didn't you tell me? I mean, that's something that used to kind of haunt me a little bit. Why didn't you tell me? And this is the reason why. This is me in 1982 with my 2 kids. How old was I? 27. I was 27. And that's when I got my diagnosis of early stage cervical cancer. I had surgery. I didn't have to have chemo. I had to have biopsies every 6 months until I was well into my 40s. And I did have some issues again with abnormal cells and had to have some TCA treatment. I had insurance. I had a doctor I had a good relationship with. I had already had my kids and had decided not to have any more after I had my 2. It's possible that I couldn't have carried a child to term after that surgery that I had, which was a cone biopsy. And, I'm one of the lucky ones, but I don't want anybody to get that phone call like I did on a Friday night saying, you need to schedule surgery for next week, which used to happen in the 80s. Now it probably would be you'd have a long wait where you could worry and have issues and problems. So one of the things that I've been saying since I learned about HPV vaccine and this is my quote, when we miss an opportunity, and when I say we, those of us who have the chance to refer, when we miss an opportunity for HPV vaccine, we create an opportunity for cancer. And I think that's it for me. And then I have my references, because I am a retired professor, you know. I'm going to tell you that last, no, I think they're all in APA format, but probably not to the degree they're supposed to be now. So that's it. And then there was a question in chat. I'm going to stop.
Yes. Thank you so much, Gail. Your presentation was amazing, and really highlights the importance of all of the school nurses, health office staff, just highlighting the CDC recommended vaccines, not just the required ones for school. We really don't want to miss that opportunity for those kids to get immunized. Is it recommended, question in the chat, is it recommended for adults to get the HPV vaccine? Would it still be effective?
Up to age 26. And it's recommended, but then that's a CDC recommendation, but anyone older than 26, I think it's I can't remember, 45 maybe. It has to be 45. It has to be a conversation between the provider and the individual to see if they're at risk. So, for example, in my community, there was you know, you think about the moms, there were sometimes widowed moms or divorced parents, or, you know, whatever. What if you have one partner, like for me, I met the husband I was married to when I was diagnosed. I was 19 years old when I met him. Now he was 32, so he had a life before me. And it's just like that whole seatbelt thing. You can't control the drivers around you, can you? So it would depend on who, if there's a new risk, okay? And then you have to, and that's an insurance issue. You have to have documented in the chart if you're 26 years, older than 26 years of age. To get that right, Laura? 26 to 40.
Yeah,
so,
shared.
But you have to think there are a whole bunch of types of serotypes of HPV, and we can immunize against 9. It won't harm anybody to get it, but there may have already been an exposure. Does that make sense? As an adult to the group.
Yes. If you have any other questions about HPV, please put them in the chat. Thank you so much, Gail. That was wonderful. We always love you have your presentations and appreciate you coming here.
Thank you. I'm going to step away just for a few minutes. I'll be back if there's other questions that.
Okay, sounds great.
Thanks. Thanks for having me.
Thank you. Okay, I just want to go back just a few slides. So we are in the middle of respiratory illness season, and I just wanted to remind everyone it's very important to keep kids healthy during respiratory illness season, along with annual flu shots. COVID-19 vaccines are updated and available. And we mentioned briefly the RSV vaccine, which is for little babies, pregnant people, and older adults. We saw record high cases of RSV last season, and so it's really important that if you are of the age to get vaccinated or are pregnant, it's really important that you get vaccinated for RSV. And the flu vaccine, we talked about that, but anyone who is 6 months of age and older is able to get the flu vaccine. It reduces the risk of severe flu-related illness by 40 to 60%. And then here's a chart about the RSV vaccines. So you can talk to your doctor. Adults 60 and over can talk to their doctor. Babies get the antibody. Infants entering or born during RSV season. And if they are high risk for next year's RSV season, they can get a RSV vaccine as well. And then babies born during RSV season, the pregnant person can get the vaccine during pregnancy if they're 32 to 36 weeks. So that's kind of some information if you have any questions about that. And the COVID-19 vaccines have been thoroughly tested, both for safety and effectiveness. So updated vaccines for the 23-24 COVID-19 season are available for ages 6 months and older. And these vaccines significantly reduce the risk of developing severe COVID complications, hospitalization, long COVID, all of that. Just a reminder that it is safe and acceptable to receive multiple vaccines at the same time. We talked about that. If you wanted to get your flu and COVID vaccine at the same time, that is completely fine. So let me skip through her slides really quick. Sorry if it makes your eyes funny for a minute. And we'll go on to the next thing. Okay. So the immunization data report. So let's talk about the IDR. It is the report that is submitted to ADHS, the health department, by schools across Arizona, and it tracks the vaccine rates in schools. Who needs to complete a school IDR? All schools in the state of Arizona, including public, private, charter schools, those that serve children who are in kindergarten or sixth grade will need to register for the IDR. Also, child care centers, preschools, all of those, depending on the amount of students they have registered, may need to complete the IDR as well. So how to get started, you gather the immunization records for all kindergarten and sixth grade students, and you will be submitting total counts rather than their student records. You'll also need to know the total number of exemptions on file, as well as how many students have exempted to every vaccine, every required vaccines. Exemptions can be for just one type of vaccine or all vaccines. So you do need to know what those exemptions are that you have. And then you'll go to the IDR webpage highlighted here. These links will be on our website as well, so don't feel like you need to write them down. Excuse me. And then you follow the steps in the tutorial to create a login, add your school, complete the survey. There's like a step-by-step tutorial of how to do that at this link as well. And that's what that tutorial looks like. So when you see it on the website, that's what you need to look for. I'd like to take a few minutes and talk about any tips that you all have for completing the IDR. If you are an experienced nurse, we do have some first-time nurses on our training today. And so I would really love for you to think about how, what tips, what processes do you have in place? Here's some that we've collected over the past few years. Save your work often. The website will time out after 1 hour and unsaved work will be lost. So you don't want to lose what you have spent all that time inputting. So make sure you save it. Don't wait until the due date to get the referrals out. Plan to do the IDR before fall break. So it's due November 15th of every year. Plan to do it before fall break. Kind of go through those records, collect which information you need, and start getting those things submitted. It's really good to plan ahead and prep for the next year at the end of this school year. So I know we are in February. We're starting to get kindergarten students registered and records are coming in for them. It's totally fine to start preparing for next year and tracking down what information you need. We do have the vaccine exemption module from the ADHS, and it would be really helpful if you watch that module yourself so you know what you are recommending those parents watch. If they say, oh, I don't know that I want to get my kid vaccinated, some administration do require the exemption module to be watched before they get an exemption form. So you as a school health office watching that module yourself can really be helpful in answering some questions for them and let the parent know what to expect. And then just know that the state law supports you. You are the health office staff, and we do need those kids immunized or have an exemption on file for them all. So make sure that you are keeping track. We really don't want to have any outbreaks in your schools. We want to keep our communities healthy. Does anyone have any tips on how completing the IDR, how you do it every year, anything like that? If you want to unmute or put your comments in the chat, I'd love to hear them.
I could give an idea as well.
Great.
Something that I do is try to prepare ahead of time and just kind of make a log, keeping track, printing out a class list, for example, of the fifth graders, printing out the phone number and the date of birth, and just kind of highlighting who's due now once they turned 11, who's due before the summer break, who's due during summer break, and who is due when we return from summer break, just in different colors, just to kind of keep my eyes, following what's going along, and putting in the daily calendar when someone is about to be due, to make sure that referral is sent, so that we can have most of the fifth graders immunized before they start if they've already turned 11. Just kind of helps it moving along instead of being slammed and sending them when there's a long line at the immunization clinic. We can do it throughout the year, works better.
That's wonderful. I love how you put those processes in place. And it sounds like you found a really good process for what works for you. I love how creative you are and highlighting different things. That's wonderful. Does anyone else have any ideas or anything different that they do when preparing the IDR?
I do.
Yeah, go ahead.
Hi, I am new here. I'm a new school nurse here in Pinyon. And just like what the other lady said, I have a list that I have made from my pre-K to fifth grade. And I went back onto our private school and I was looking through all the birth dates, and some of them were flagging for different things, just like hip A, MMR, all these different vaccines. And that's how I went upon that. And especially for my fourth and fifth graders, and some of them are 11 years old, I did send out notices and tell them, vaccines are due. And so at the bottom of my list, I usually have like the birth dates of the students. And then the day after their birth date, that's when I sent out the notice of, updated immunization needs to be brought in for them.
That's wonderful. So very similar, but a little bit different to what works for you. So that is wonderful. Anyone else? Okay, if you think about any other tips or, hopefully this has kind of sparked some ideas for people. If you think of anything else, please put it in the chat. We'd love to hear it. We do have a specific email address if you have questions or need assistance while completing the IDR. So the email address is highlighted here, and we will have this listed on our website of resources as well. There are some great people in that office that are quick to return your calls or emails. So if you have any questions at all, please let them know. That goes to the State Health Department. How about another trivia question? Who needs to complete an IDR? So use the chat box. A, licensed childcare providers, B, schools, C, preschools, or D, all of the above. A A lot of people saying D, a few, 1A, 1C. The answer is D, all of the above. So licensed childcare providers, preschools, daycare, that type of provider, schools, private schools, charter schools, all of those need to, public schools, all of those need to complete the IDR. How often do you need to complete the IDR? Does anyone know? This one's an easy question. Annually, yes, every year. And for the last few years, it's been due November 15th. I think that is the set date, kind of like tax season. It usually is around the same time each year. So yeah, once a year. Here's a few other questions that we have gotten. Is there a family education requirement to accompany personal exemption forms? We do have the exemption module through ADHS. That goes through the different vaccines, what would happen if you exempt your child from that, that they could get severe disease, all of that and exposure. So yes, there is an exemption module. It really depends on if your administration requires that before giving that personal exemption forms. I know that Mesa Public Schools, their administration does require that, and they have seen great success in a very small number of personal exemptions. Okay, get ready. Here's another trivia question. I can't find a record in ACEs for my student. This means they are not vaccinated. True or false? A is true, B is false, and C is not sure. Okay, you all know that this is false. Students may not have a record in ACEs if they have recently moved from out of state, if their provider hasn't entered immunizations into ACEs, or if the patient record needs to be merged with another record. You can definitely contact the ACEs help desk if you need help. If you see that maybe there's two that are probably the same person and we need to merge together, you can contact the ACEs help desk and they will help you take care of that. So good job. You all knew that one. I'm going to skip through to a few resources because we are coming up at the end of our time. So let me skip ahead just a little bit. If you have any other specific questions, please let me know. I'd be happy to answer them. Just put them in the chat. Okay. It's really important that you know where to find reliable resources. Know which apps, websites, books, and videos are from trusted sources. We have this handout here on the right. We have it listed on our website along with a bunch of other links. So this is a great handout to give to parents if they are wanting more information. You can download it from our website or we can send that to you. But there's different websites, the American Academy of Pediatrics, the CDC, Department of Health and Human Services, different mobile apps that are great. Books, if parents have questions about different vaccines, you can recommend different books, videos, websites, all of these. These are two of the best sources, the best websites to access valid and reliable information about vaccines. So if you run into another question or if you think of something that after this training, these are great places to look for answers. We have the Vaccine Education Center at the Children's Hospital of Philadelphia, also known as CHOP. They have videos that you could show parents about specific questions or common questions you may have. And then, of course, we always recommend the Centers for Disease Control and Prevention, the CDC. They have information about specific vaccines, side effects, the information sheet, all different information for vaccines there. Let's see, the next thing I wanted to show everyone is our school nurse webpage. So this is a very helpful resource where we have collected a lot of different information, all for school nurses and health office staff. So we have COVID information, links to forms for the IDR or requirements. We also have communication samples to give to parents if you need a specific letter to send out or you're looking for an immunization schedule. This is a great resource. The link will be in the thank you email today. All of these links will be included. I'll show you where to find this. So we also have a second part on this website that is meant for parents. So that has handouts for parents, but also like coloring sheets with a vaccine schedule on the back to give out. There's information about flu season, reminding students to cover their cough, things like that. I saw the question in the chat about posters, and I'll get to that in 1 second. I'm going to show you what we have now. I also wanted to show you this vaccine conversations and parent handouts. So this handout on the left was developed by our coalition members. It's talking points and guidance of how to answer those tough questions. We also have, if you have a parent that says, I don't want to get my kid vaccinated, or is it really important to get all the vaccines? It can give you some quick talking points and help you feel more comfortable in how to answer questions about vaccines. And then on the right is our TAPI website, whyimmunize.org, where we have many different resources, a whole page just for school nurses, and then a page for free materials. So these are a sample of some of our free resources. We have different flyers for different things. So we have a lot of different schedules, vaccine schedules. We have little kids up to age 6. Then we have school age kids, 7 to 18. We also have schedules for adults, flyers about flu, COVID, flyers for the whole family, all kinds of different resources. These are all free and available on our website. Blanca, you are awesome for posting the school nurse website in the chat as well as the free material. So look for that and I can send that out with the thank you email as well. So these flyers are free, like I said, and sometimes it's really helpful to post some of these in your school health office. This one in the center on the bottom, if you can see my mouse, we have a lot of nurses that love to put this up in their office, and it just reminds people to wash their hands, cover their cough, try to stop the spread of illness. If you are interested in ordering any of these, check out that link in the chat. We will print them and ship them to you for free. You can also download and print them directly from our website. I always love to highlight the Vaccines for Children program. The decision to vaccinate should never making the decision to vaccinate should never be an issue of cost. So the Vaccine for Children program allows children who qualify, either their income is low, they don't have health insurance, their health insurance doesn't cover vaccines, they can all go to the Vaccine for Children's program, which allows for free vaccination. I love this flyer because it shows how many different illnesses are prevented. So the CDC estimates that vaccination of children born between 1994 and 2021 will prevent 472 million illnesses. That is such a huge number, it's hard to even think about, but it also will help avoid over 1 million deaths. So if you need a flyer for this, if you wanted to post this in your health office, just letting people know that this program is available, we can help you find a provider near you. Okay, that is the end of our training today. So thank you so much to our presenters today. Thank you so much, Gail. Like it's amazing. I love it when she comes and talks about HPV and the importance of it. We do have a survey to share today. If you want to fill out the survey and let us know how we did, your feedback will help us improve future trainings. If there's anything that you think could have been better, let us know. If there's something you liked, also let us know. I'll post that link in just a second. And then we also, I will be sending the link for CEU credits if you are interested in that. So if you are a registered nurse, social worker, certified health education specialist, or medical assistant, you can receive CEUs for today's training. So we
I
have
just one thing I wanted to say that I wasn't able to, real quickly for all you guys. It's in statute that HPV vaccine will not ever be on the school schedule. And we don't want to, when we talk about policy, when I teach policy to my nursing students, I always talk about little p, middle P, and big P. That's at the big P policy level, that HPV vaccine will not be on the school schedule, as well as COVID will not be on the school schedule. It's in statute. It's 36-672. That's the number. And so what it's our job to work at that small piece schedule that we among ourselves as frontline healthcare personnel, that we work to prevent diseases that can be prevented with vaccines. So I just wanted to let everybody know that's nothing we'll ever go forward with the state legislature at this point in time. So it is up to us, and I'm so happy that it's still on the referral letter. So anyway, thank you guys so much for everything that you do.
Thank you, Gail. I put the link to the survey in the chat box. Gloria, I'm so sorry that link didn't work. So the recording will be available on our website by tomorrow. It takes a little time to upload, but you can definitely go back and watch that. We will have another training in October of this year. So if this was helpful to you and you think it'd be helpful to one of your coworkers, please let them know about it and maybe they can watch the next one. We have 2 more minutes. Does anyone have any other questions?
I'm going to ask if people are seeing chicken pox. Is anybody seeing? I used to see it at Easter, so I'm thinking this is chicken pox season the way it used to be in the 90s. Or are your kids pretty much vaccinated against that now? We didn't have a vaccine when I was a school nurse, so I mean for an elementary school. Anybody seeing chicken pox?
I have a question.
Yeah, go ahead.
So some of my my students, that HPV, the second dose, is that required?
For HPV, yes. Yes. Well, it's recommended. So HPV, like Gail just said, is not a required school vaccine. But if you get the first dose of HPV, you definitely need that second dose. If you are over 15 when you get your first dose of HPV, you do need 3 doses.
Oh, okay. So and then
so yeah.
I had another question. So
Jolinda, if you see that your student has 1 HPV dose, you're going to want to highlight that form again and get them back in to get their second dose to complete that series.
So I have another question. So I usually send notices like every week, and I give them 3 notices, and so the 4th one I usually send them home. But is that like one of the recommendations that we could do?
So that question is along with along with Tina, she just put in the chat, when does it become necessary to exclude exempted students when there's a measles outbreak or confirmed case? Is this a district-specific policy? Yes, it is. So both of those, the answer to both of those questions is it is going to depend on your administration when you need to exclude students. However, you are the nurse, you are the health office staff. So you really do have the background and knowledge to talk to your administrator and let them know how important it is to get those kids vaccinated. Of course, we never want to exclude students from school. We want them in classrooms. But in the case of an outbreak, your school could be held liable, if there's an issue there. So just let them, talk to your administration about it, make sure you're following their rules, but also have a conversation and let them know how important it is to make sure kids are immunized.
Okay, I have another question. So what about the hip A? Is the second dose required?
I am not familiar with that requirement exactly. So it depends on the age of the child and all of that. So let me find out some more information and email that out. Jolinda, that was you asking?
Yes.
Okay. I will email that to you.
Okay.
Okay, any last questions?
I have another question. I'm sorry. Um, so I have some pre-Ks where some of their vaccine are not, like some of them have that IPV and the MMR that are flagging on our Power School. How is that?
Okay, I'm adding that to my list of questions as well. I'm going to reach out to the school health office through ADHS, that email that we had, and
Yes.
and get some answers from those nurses. Yeah.
Okay. And just go ahead and
Thank you.
email me. So
Yes.
so a lot of my students, the fourth and fifth grade, some of them are turning 11, and I did have sent out notices just like I do like the third notice and the fourth, like the fourth week, I send them home, and the parents are the one that come back at me and say, I did turn in update immunization. I try to explain to them that once they turn 11, there's 2 vaccines that need to be given. So
there is an updated recommendation from the state health department that they have until their 12th birthday to get that vaccine, get those records updated. So that is new in the past year, where they do have up until age 12.
Okay.
Yeah. Let's see. Tina is asking, are any other schools seeing exemptions due to incorrect timing on doses? Parents opt not to re-immunize. Okay, yes, a lot. So I would definitely talk to those parents and talk about how they are leaving the door open to their child to get that disease if they're not fully immunized. And if they've already, can talk to their doctor about it for sure, but I would definitely encourage that. Sounds like a few other schools are seeing this.
Can I speak to that from a nursing perspective?
Yeah.
About there's a lot of confusion about timing. As long as the minimum interval was met, you can look at the catch-up schedule, you're okay. It's okay. They're protected as long as it's minimum intervals met. If it's been a long time between, that's okay too. You never need to restart the vaccine series. Whoever asked that question.
Do you all have access to those catch-up schedules, or would that be helpful to include in the email? So you can look at it. Helpful? Okay, I'll include that.
I've had I think I had every issue come up in my practice so far. So, and also you can learn from my mistakes. I got in trouble with the school board because I told the kid they couldn't come back to school without, my district didn't believe in that, like when they didn't, after I sent out my 3 notices. So it really, I got myself into a lot of trouble with the administration. And probably you guys know who've been in practice for a long time. Maybe you've been there too, but I always tell people learn from my mistakes.
And then one other question from Linda: why would we only require 1 varicella vaccine? We recommend 2 when other states require 2 varicella vaccines. So that is typically set by the state health department on those recommended or the required vaccines.
And in legislation, Laura.
And in legislation, yeah.
You don't want to, it's about not poking the bear. Too. You got the one on, and then when varicella vaccine was originally released, it was only 1, and then we started giving 2, so it went on the schedule as 1. Does that make sense, you guys?
I think we got through all the questions. I am going to put my email in the chat in case anyone has any follow-up questions or wanted some resources we talked about. Please expect a thank you email by tomorrow. I want to make sure the website is updated with the recording, and then I'll send it out with the links. And thank you all for coming today. This was great. Thank you for the conversation, and it's super helpful to learn from each other. You can obtain your CEUs. I will include that survey link in the thank you email that will be sent out tomorrow. And that's it. So everyone have a good rest of the day. Hope you have a great day. Thank you, everyone.
You have a minute for me, Laura?
Yes.
Okay.
Just stay on for a minute.